Welcome back. Do you ever have those moments when you feel just a little betrayed by your bladder? Maybe you laugh or sneeze and lose control just a little bit. Well, in this week's Medical Center Health Systems Taking Care of You, our guest is Dr. Avelino Garcia. We're talking about the dreaded urinary incontinence, and we're here in your office today because, shocker, this guy's hard to track down. You've been delivering babies this week.
Oh, something. Yeah.
No, that might be one of the things that leads to this issue. So I guess that's my first question. Why do we have this issue with our bladder, this urinary incontinence?
For a better understanding about urinary incontinence, I think that there is three main groups of urinary incontinence. One is called the stress urinary incontinence, which is the one that is related to bad support. So the symptoms are basically leaking urine when you sneeze, when you jump, when you are walking, when you're exercising. That's called the stress urinary incontinence. The second group, mostly common, is the urge incontinence, when the patient has this feeling of urgency and they cannot control it, and eventually they leak. They need to go to the restroom immediately. Mm-hmm. And the third one is the overflow, when the patient cannot empty the bladder completely and eventually reach the point where when the bladder is too full and then starts leaking urine.
Okay.
Each one of them have different approaches in regards of treatment.
Okay, so let's talk about that. What can we do about this issue?
Well, in regards to the stress incontinence, since the problem is mainly bad support of the bladder, the treatment comes to be mainly a surgical treatment with trying to improve the support of the bladder.
Okay.
The urge incontinence, on the other hand, is more a problem of balance between the contractions and the relaxation of the bladder, and that is basically achieved with medications, okay, not with surgery. Okay. That's the reason why whenever you are facing a problem with a patient with incontinence, you have to do a complete evaluation of what is really going on. Sometimes the problem is mixed, and the patient requires not just the medication but also the surgery. Some patients who have this surgical procedure done sometimes continue having symptoms of urge incontinence, and they are disappointed because they think that the surgery is going to fix everything. But the reality is that if there's a mixed incontinence, eventually some more problems will continue to happen.
Okay, so the bottom line is, once again, this is a conversation that you have to have with your doctor, and there are things that can be done, because this can be a problem in our real everyday lives if we can't get control of it.
And it's very common, and the main thing is that it can isolate a patient and
yes,
affect the quality of life greatly.
Dr. Garcia, thank you so much. Next week, we are going to have your questions answered on the air. So if you have any questions, send us an email at Studio 7. We won't mention your name, but we will get those questions answered. Some frank conversations with someone who is good at answering them. Thank you so much for being our guest today.
Thank you.